So what is a futures market? Well, when you invest in stocks, you're investing in a company. When you invest in bonds, you're investing in a revenue stream. But future markets are the ways we solve economic problems. So in the 70s, when oil was the economic problem and there were no futures contracts in oil, everybody thought that we were going to have to control oil prices or have government command and control. But that's not what happened. We created a futures market in oil. What does that mean? It allowed people to hedge and speculate on the future price of oil and the future supply and demand of oil as a way of lowering prices, stabilizing volatility, creating transparent price setting mechanisms, and letting demand have a voice so you can see what you need to deal with if you're an oil supplier. When interest rates went through the roof and mortgages were 16% in the late 70s, the answer was financial futures. How can we take a position, either rates will go up or rates will go down? And when you ask the market to take a position, the market tends to take both sides, and interest rates stabilized and they came down. So what's the biggest economic problem today? Healthcare. It's the leading cause of bankruptcy. When food prices go up, people don't stop eating. When gas prices go up, most of the time people don't stop driving or sell their cars. But when health prices go up, people stop going to the doctor or they lose their insurance. And as a result, they end up dying of things that we could prevent and treat. So why hasn't there been a futures market in healthcare? Well, there are two reasons. One is psychological, and the other is about the markets. The psychological reason that there hasn't been a healthcare futures market is that people think that healthcare is only a cost. When oil went through the roof in the 70s, people said oil was a cost, but they turned it into an asset by creating futures market around oil. We have to do the same thing today with healthcare. Healthcare as a cost is just something you budget to pay. But if you think of healthcare as an asset, then you can invest in it, you can securitize it, you can own it, you can lease it, you can borrow it. It is an asset. So what is the difference between trading a futures contract in the price of oil next year and trading a futures contract on the price of diabetes care next year? As a financial level, there's no difference at all. So why hasn't it happened? Well, several reasons. First, most people do think of health as a cost and they've never made the switch. Secondly, you have to have something that is the asset. So 30, 40 years ago, there were very few things that healthcare could offer you to cure you. If you had a heart attack 30 years ago, you stayed in bed and you took aspirin until you felt good enough to go back to work. Today, it's a $250,000 proposition. If you have cancer 30 years ago, they either cut it out, poisoned you, or burned you with radiation, and that was that. And there wasn't much to do, so there wasn't much to pay for. But as a country and as a world, we have now transitioned from chronic care health system to a curative care health system. We have products now that cure cancer, that cure hepatitis, that can diminish the impact of diabetes. All of those things are expensive. And that's why you have to have a futures market. So if you make the change that health is an asset and not just a cost, and you realize the potential for a futures market to address the economic disturbance caused by the cost of healthcare, then the question is, how do we measure it? 20 years ago, there were no electronic medical records available to most people. 10 years ago, we just started requiring electronic medical records. Today, we can look at literally billions of claims of people's cost in dealing with the healthcare system for any disease that you can think of. So now we've changed our mind. We know health is an asset, and we have the data to measure everything going on in healthcare. So the futures market in healthcare is now a reality. So how does this work and why does it matter? Well, let's take oil, for instance. We spend $450 billion a year on oil. We spend the same amount on diabetes. In the oil market, the derivative market, the people betting on the future of oil, is $650 billion. It's more than we actually spend on the oil itself. Take Diabetes again. We spend the same amount we spend on oil, but how much do we have in the derivative market for diabetes? Zero. So migraines, you probably don't think about migraines that much unless you have them, but the market for migraine drugs is as big as the market for wheat. Think about that. There has been a futures market in wheat for 200 years. And yet the migraine market is just as big and there's no derivative market for it at all. Well, why does that matter? Uncertainty is the enemy in capital markets. So if you're an insurance company, you don't know what patients you're going to have next year until next year. You don't know if you're going to have twice as many diabetics, twice as many people with rare diseases, twice as many people with cancer, or half as many people. So you have to guess. And what do you do to hedge that potential liability? You raise your premiums. Or worse, if a drug comes on the market you didn't expect that cures something, you make it hard to get. You tell people you can't get this drug until you're on death's door. This is a non-economic way to hedge the future. What we're providing is an economic way to hedge the future. So how does this work? Well, there's several different ways to do this. So as an example, we're all familiar with seeing the S&P index going up or down, or the price of oil going up or down. Well, guess what? The price per person to treat in any given disease also goes up or down, depending on how many people, what drugs they're getting, where they live, what kind of insurance they have. And now we have the data, we can look at all of that. So you're an insurance company and you're worried that you're going to pay 20% more next year for diabetes than you want to, and that you can under your existing premiums. So in the old days, you raised your premiums. Now you can enter into a contract. You look at a diabetes index and it goes up or down over a period of time. And if you're the insurance company, you say, I'm going to make a bet that the index is going to go up, because if it goes up, I have to pay that cost. So I'll make money from my bet on the index going up, and I'll use that money as a hedge to pay off my increased liability. If you're a company that provides diabetes services like DaVita, which provides dialysis, if there's a new technology that's going to lower the cost of dialysis, you're worried you're going to lose money in revenue. You're not paying, you're getting. So you want to bet that that price of that index to treat diabetes will go down. So you will make money if people learn how to save money on treating diabetes. You don't lose all of it, you have a hedge. So you have a way of guaranteeing that you have some income even when things go down. If you're, let's say, a hospital, at the beginning of COVID, oil companies that have a derivative market made billions of dollars by making a bet that the price of oil would go down, which of course it did, down to $20 a barrel, which is not a profitable level for oil companies. So they took the $1 billion they made shorting oil, betting it would go down, and they waited for the market to come back. And now they're making money hand over fist selling oil at $100 a barrel. What about hospitals? Well, hospitals at the beginning of COVID could no longer do elective surgeries like knee replacements and hip replacements. So the hospitals in the United States as a group lost $50 billion a month because of the loss of revenue from elective surgeries. Imagine if they had done what the oil companies did. Imagine at the start of COVID, when they saw this coming, they had said, we're going to pre-sell the number of knee replacements that we expect to do next year and the number of hip replacements we plan to do next year. And as a result, the people who pay for those, the insurance companies, would get a better price because they're paying in advance in bulk. The hospital gets access to a contractual obligation to pay them X amount of money. They can take that obligation to the bank and borrow against it. And the patient, it couldn't do the surgery anyway because it wasn't allowed. So they're not out anything. They just have to live with a bad knee or a bad hip for a little longer, but it's not an economic issue. So why didn't hospitals do that? Because they didn't think about health as an asset, and they had nowhere to go and list those contracts for the whole world to see. Because, you know, a hospital didn't have to just deal with one insurance company. They could say, we're going to sell all of our knee replacements next year for X or the best offer. And any insurance company could come in and buy those knee replacements. So all of those are examples of how a futures market makes a difference. So let's talk about Ford Motor Company. So Ford Motor Company and most of the Fortune 500 are self-insured. Why is that? Well, if Ford Motor Company was insured by United and they said, how much am I going to pay for healthcare 4 years from now? United would say, we have no idea, because we don't even know who our employees are going to be in 4 years. How do we know who the insured is going to be? Meanwhile, Ford knows that they have to price their cars 4 years out. And they know that today there's $2,200 in each car's price that represents the cost of healthcare for their employees. So they want to know, is it going to be $3,000 or $4,000 or less 4 years from now? Insurance companies can't tell them. So Ford manages their own healthcare system, and they only use the insurance companies to administer it, but they make their own premiums, et cetera. Well, in our scenario, Ford could enter into a contract that says we will pay you X over the next 4 years to deliver these healthcare services and surgeries and products. And somebody would engage in that contract with them, because keep in mind, you're dealing with uncertainty. So the people who provide the services don't want uncertainty, and the people who are paying for them really don't want uncertainty, which is why a futures market is so successful in every other sector. So now we get down to, how does this change the whole system? Well, you'll notice that in agriculture, in energy, all these other businesses, people make money when prices go down because they made a bet that prices would go down. Nobody makes money in healthcare when prices go down. Therefore, prices never go down. Hospitals don't kick people out. They like to be full. Empty bed doesn't generate revenue. Doctors do more and more because they get paid for doing things. The insurance companies and the pharmaceutical companies are in a constant battle because the drug companies want to maximize revenue in fear of new competition coming in. And the insurance companies want to minimize expenses because they don't want to pay for a $300,000 or $400,000 drug, even if it cures the patient. So what do? The drug companies raise their prices really high, and the insurance companies put all kinds of barriers in the way of people getting these new drugs, pre-authorization, and all of those kinds of things. So imagine this. Imagine if the drug companies and the insurance companies actually invested together. Imagine if they took out a contract that said the insurance company will help develop the drug in return for a long-term lower price for the patients getting the drug. Pharma could then have a lower price and the same margin, and the insurance companies could have the same products at a lower price. Everybody benefits. But that's not the system we have. That's the system we're going to have when the IMX Healthcare Exchange is fully operational. Now, all of these problems in healthcare, the cost of drugs, the cost of hospitalization, the cost of rare diseases. One insurance executive told me that 12 families cost him $60 million because of their rare diseases. So imagine all of these people trying to deal with this in a cash flow business. There are no cash flow businesses other than healthcare, because every other sector of the economy has a futures market. The paper industry, the weather industry, all have a futures market, but the largest sector of the economy is a cash flow economy. So if you present the opportunity to hedge your expenses, to speculate on your increased revenue, to lower your cost at the same margin, because you no longer have to worry that there's going to be increased competition and you lose everything, you have a long-term contract to sell your drugs because you cooperated at the beginning through a development contract you could list on a futures exchange. All of these things lead to one conclusion. The only way to deal with healthcare as the leading cause of bankruptcy and the leading sponge for our gross domestic product isn't exports from Canada, isn't government controls on prices, isn't Medicare negotiation. It is the ability of the market to have transparent price setting, to have visible supply and demand, and to give every player in the healthcare market the opportunity to hedge or speculate on whatever it is that keeps them up at night. And now with the data we have, we can do that in a very specific, fine-grained way for any problem that any participant in the healthcare market has. And they would all have a place to trade on the IMX exchange.